Hello, I'm Priscilla Benner. I am your presenter for the Child Survival Training for Medical Brigades course. I'm a physician. I have a medical practice, internal medicine at the Valley Medical Center in Pennsburg, Pennsylvania. I also work with DeSales University in Central Valley, Pennsylvania as a preceptor for PA and nurse practitioner students, and I'm the director of Mama Project. Now, Mama Project, you might wonder where we got that name. We started out 30 some years ago as a partnership between women's groups in Honduras and Pennsylvania. They speak Spanish in Honduras, and so our acronym MAMA is half Spanish and half English. The words Mujeres Amigas mean women friends, and miles apart is the second half of the acronym because although we are miles apart, we're united to work on common cause, which is working with communities that have high indices of malnutrition and high infant mortality rates. Now, the program has grown. We're in many other places, and we are expanding. A big part of our strategy is still working in partnership, working in communities, and we train medical brigades to do things that can help make a difference in the community, even with short-term experiences. So we work long distance, short distance, and with many different levels of strategy, including advocacy with ministries of health, including training of health workers on the ground wherever we're working, and that is the kind of approach that we will be sharing with you. So, a message from Mama Project. The causes of child mortality are global and multiple, but great strides are being made by focusing on a few simple things, including things like water, worms, and malnutrition. Also, while advances in medical science have saved millions of children, millions are still left behind. Now, whether we're seeing the sick child through the eyes of the mother or from the point of view of a person wanting to help tip the scale of justice in favor of that child, we all need to learn how best to help. This training is geared toward people who wish to explore the context of child survival from a medical, nutritional, and social perspective. Much of the material presented in this introduction is sourced from the World Health Organization and UNICEF, with focus on children up to the age of 60 months and childbearing women. The materials that we're sharing also include expansions of recommendations to school-age children, youth, and adults, including pregnant women. We include information on specific common illnesses that would be encountered in medical brigades, and we share information on tools that we discovered or created to facilitate the goals of promoting community-based health and nutritional efforts. Child survival. What in the world is going on? Vulnerable women and children are dying. Where? Why? Who's doing something about it? And what can be done? In 2018, an estimated 6.2 million children and adolescents under the age of 15 years died, mostly from preventable diseases. Of these deaths, 5.3 million occurred in the first 5 years of life, with almost half of these in the first month. Now, how do we define child mortality? It is the probability per 1,000 live births that a newborn baby will die before reaching age 5 under the current age-specific mortality patterns. If nothing changes in the next 5 years, this is their risk of dying before they reach age 5. Infant mortality, the definition is the number of deaths of children under 1 year of age per 1,000 live births. And neonatal mortality is defined as the probability that a newborn will die within the first month of life per 1,000 live births. The risk of death is highest in the first month. The rate fell to 18 deaths per 1,000 live births in 2018 from 37 in 1990. Maternal mortality ratio is a bit different. The definition is the number of registered maternal deaths due to birth or pregnancy-related complications per 100,000 registered live births. Now, we have to think about the fact that in these conditions, in these communities, often multi-parity is the rule. Many mothers have numerous children. So if the mortality rate per is figured on live births, it is you have to think of the number of children that she's going to have in her childbearing years and multiply that times the rate per birth. Maternal mortality declined by 38% between 2000 and 2017, reported by UNICEF in September of 2019. From 2000 to 2017, the global maternity mortality rate fell from 342 deaths to 211 deaths per 100,000 live births, according to the UN interagency estimates. But in some countries, it is still over 1,000, meaning that a woman faces a 1 per 100 chance of dying from the birth of each child that she delivers. Now, this is the map of where the maternal mortality ratios are the highest. It's much better to be in a dark blue country, which is much of Europe, North America, good part of South America, but those are very low, under 100 deaths per 100,000, so under 1 per 1,000 births, it results in maternal mortality. The lighter blue is low. We're starting to get into high mortality between 300 and 499 in the orange, or in the yellow gold. In the orange, it's very high, 500 to 999. And extremely high is the dark rust colored. And again, you see the highest, deeper orange and yellow, orange, and red colors in the African countries below the Sahara. On an average, 15,000 children under 5 die each day, compared with 34,000 in 1990. Since 1990, the global under 5 mortality rate has dropped by 59%, from 93 deaths per 1,000 live births in 1990 to 39 in 2018. This is equivalent to 1 in 11 children dying before reaching age 5 in 1990, compared to 1 in 26 in 2018. Now, this is wonderful progress. However, there's still many parts, particularly in Africa, parts of the world, where 1 in 4 children is not expected to reach their 5th birthday. And we have to think back historically in our own country, in the cities, the turn of the last century, early 1900s, there were many places with very high infant mortality rates that rival the worst parts of Africa. But much progress has been made. We can say you've come a long way, baby, but that progress has not reached all of the children. The leading causes of death in children under 5 years are preterm birth complications, pneumonia, birth asphyxia, congenital anomalies, diarrhea, and malaria. Nearly half of these deaths are in newborns. Sub-Saharan Africa remains a region with the highest under 5 mortality in the world, with 1 child in 13 dying before his or her 5th birthday, 15 times higher than in high-income countries. Now, this is another map of the spread across the globe of where the under 5 mortality rates are the highest, and it is no surprise again to see Africa, the African continent, with the darkest brown indicating the under 5 mortality of greater than 100%, greater than 100 per 1,000 live births in a number of the African countries, dropping to still very high, 75 to 100, and the lighter brown, 40 to 75 in the sort of rust-colored, and in the gold, 20 to 40, and in the green 10 to 25, and in the pale under 10. Now, more than half of these early child deaths are or would be preventable with simple, affordable interventions, including immunization, adequate nutrition, safe water and food, and appropriate care by a trained health provider when needed. Now, the leading causes of death, pneumonia and childhood diarrhea, and that's not a spelling error, that's the way diarrhea is spelt in most of the English-speaking world, except in the United States. The risk factors are low birth weight, malnutrition, non-breastfed children, overcrowded conditions, unsafe drinking water and food, and poor hygiene practices. The same risk factors as were present in our cities and communities in our part of the world 100 years ago. So this is not about being African, or it's really, these are diseases of poverty and lack of opportunity. Prevention, antenatal care visits for the mother, adequate nutrition, exclusive breastfeeding, reduction of household air pollution. The air pollution is interesting. Smoking fires causing irritation, leading to infection and pneumonia in children who are exposed to in-house cooking fires is a huge problem. Vaccinations, safe water and food, adequate sanitation and hygiene. Treatment, appropriate care by trained health provider, antibiotics, oxygen for severe illness, low osmolarity, oral rehydration salts, and zinc supplements. If some of those things are not familiar topics, we'll get to them. Malnourished children, particularly those with severe acute malnutrition, have a high risk of death from common childhood illnesses such as diarrhea, pneumonia, malaria. Nutrition-related factors contribute to about 45% of deaths in children under 5 years of age. Every year, UNICEF writes a report on the state of the world's children. They've been doing this for years and years. In 2019 was the first year that the entire 258-page document focused on child malnutrition. They also separate out the regions: North America, South and Central America, Europe, Africa, Asia, the different parts of the globe have different challenges and different rates of progress. So the big picture, looking at the whole report, the conclusion was that the world's food system is failing children on a massive global scale. Childhood hunger is a root cause of most of the deaths. Malnutrition causes immune deficiency. You wonder, how does malnutrition cause children to die, even when they're not visibly horribly malnourished? It affects the immune system. Common childhood illness infections turn into killer childhood diseases. Now, extreme malnutrition, this image is what some people think they will see when they are looking at populations with a lot of malnutrition. This, thankfully, is not the kind of scene that you're going to see in most situations. This can be in famine and war and just very, genocide or displaced people, when there is widespread, acute, severe malnutrition. It's horrible, it's tragic, it's dangerous, and it's easy to recognize. But thankfully, this isn't really the picture that is the most common scenario. Mild to moderate malnutrition causes most of the millions of annual cases of childhood nutrition-related mortality. Now, this is not intuitive. You've got to think about this. If it's so bad to be so severely malnourished, how can we say that mild to moderate malnutrition is causing most of the deaths? It is. Thankfully, the severe malnutrition is much less common. Mild to moderate is widespread. It's affecting the immune system. These children are unable to fight off infections, and therefore, in communities with chronic stunting malnutrition, chronic malnutrition, even if it isn't visible, those are the communities that most of the children are dying in. This problem affects the majority of Sub-Saharan African children. It's more common, mild to moderate malnutrition is more common than severe malnutrition. It's sometimes called hidden hunger or micronutrient malnutrition, and the way you detect it is to detect stunting. Now, where do stunted children live? Again, we see a world map. And it is much worse to be in the orange and the red, and not to our surprise, Africa and Asia and the Pacific Islands are the places with most of the chronic stunting malnutrition. Now, let's think again about the picture of the issues. Poverty and injustice are the root causes of malnutrition. Yet, childhood hunger can be ended. It's 100% curable. Malnutrition does not have to kill millions of children. That is preventable. And it's urgent. Today's children cannot wait for global poverty elimination and the advent of social. Irreversible damage is being done today and every day that pregnant women and young children suffer from malnutrition. Neglected hunger, even hidden hunger, has permanent consequences in developing brains, bodies, and spirits. And they won't be children forever. Between the moment of conception to the second birthday, those 1,000 days are the most critical days of the development of the child. That is the window of opportunity, and it doesn't last long. It is a quickly closing window of opportunity to help the next generation be strong, healthy, and productive. And this is where the statistics can be found.